Hello, everyone. Welcome to the Planetary Health and Climate Justice webinar with EPHA. While we are still waiting for people to come in, I will quickly go through a few housekeeping rules. Next slide, please. So we are very excited to have you here today, and we look forward to your participation in this discussion. And we would also encourage you throughout to use the Q&A and chat function to contribute to discussion with the speakers. We would also like to remind you that the webinar will be recorded and it will be shared after on the EPHA YouTube channel. Thank you. So the European Public Health Alliance is an international civil society organization established in Brussels in Belgium, and in collaboration with its 75 members, which includes civil society organizations, health practitioners, and public health actors. Its mission is really to advocate for the promotion and improvement of public health in Europe. So this includes both within health policies, but also across all other relevant sectors. So of course, in this case, this includes climate change, planetary health, and environmental justice. Now, the aim of this webinar is to really start delving into how we can bridge the gap between climate and public health research with ethical considerations, and also strategies to advocate for having a future that prioritizes planetary health and also global health equity. So our guests today are representing international, national, and local actors across the WHO European region, and they will offer an overview of the pressing issues at hand, their relevant and recent actions, but also any opportunities and barriers they may face in adapting and mitigating to climate change. So with that, we will start with a brief look into the intersection between climate change and health from myself and Kale Lawlor, who is the Senior Policy Manager in Global Public Health at EPHA.
Thank you, Louise. Thank you for the introduction there, and welcome everyone to the webinar today. We're really excited to have you here. We've got a lot of speakers lined up, but firstly, I'll introduce myself. Louise touched on it there. My name is Kale Lawlor, Senior Policy Manager working in Global Public Health here at EPHA. And we're going to have a lot of discussions today, which will give us a lot of unique insights into different public health risks around climate change in the WHO European region, and kind of where we need to go and the current state of play. But to set the scene first, I'm going to give a bit of a background of where we are and how we can think about these public health risks in regards to climate change. And then we're going to go back to Louise. She'll give a bit more of an in-depth case study, and then we'll get to some of our very exciting speakers. So next slide, please. So when we're thinking about climate change, the science is now established and settled that climate change is anthropogenic. And now we have the challenge of communicating and working with how we go from here and what we do next, instead of trying to convince people that it's real. As we can see here, the global surface temperature of the planet has increased faster since 1970 than any other 50-year period in the last 2,000 years. And this is quite a famous graph. I'm sure a lot of you have seen it, where just this dramatic increase in temperature, and that's in correlation with carbon dioxide concentration in the atmosphere. Next slide, thanks. So we have the 1.5 degree target, but the World Economic Forum has said that that's a physical limit and not a political target. That's really the limit of where start seeing major climate breakdown. So it's not just a political figure to aim for, it is actually that physical limit. Next slide, thanks. So at EPHA, we want to approach climate change through a planetary health lens. Now, planetary health is a overarching concept that sees human health and environmental health, like the health of our planet, as interlinked and dependent on, well, human health is dependent on environmental health. Our civilization depends on it, depends on flourishing natural systems and wise stewardship of natural resources. So we have underlying and ecological drivers such as consumption, pollution, biodiversity, and then we have, so those are the overarching kind of systems we live in. We have more proximate causes closer to each of us, such as the air quality, the food we eat, infectious disease risks, and natural hazards. We have factors that mediate our experience and our living in this planet, which are culture, technology, philanthropy, wealth, governance. And then all of those together in this concept, the health effects that come from that, which can be positive, can be negative. But if we have planetary health breakdown, we'll have human health breakdown as well, in the form of malnutrition, infectious disease, rise in non-communicable disease, mental health, and displacement and conflict. Next slide, thanks. So when we're looking at public health and climate change, we have a number of spheres of different public health effects. We have different social effects and different kind of health realms here we can see on the left. So things like food security, water security, energy security, migration all have a massive effect on a society, on public health, but then we also have straight up public health risks such as communicable disease and non-communicable disease and mental health. This figure in the middle here shows a bit of the intersection of all of these sorts of public health risks. So if we look at one here, more extreme weather can impact air pollution, which impacts respiratory and cardiovascular health, for example. Environmental degradation can lead to forced migration, conflict, and mental health effects. So we're going to look at some of these today, and we'll go into a bit more details on some just now. Next slide, thanks. We can also look at this from the aspect of vulnerable populations, and that's something we work with a lot, is around health equity. So we've got different vulnerable populations and marginalised populations. Populations like children and youth are more maybe vulnerable to some effects of a changing climate, whereas some people are maybe more marginalised with less ability to adapt and be resilient to changes because of an already stressed system. So we can look at it from this point of view as well. Say if we look at Indigenous and ethnic minorities who already start on a different footing because of the social determinants of health and how society kind of treats different populations. Any changes to climate, any extra stress can affect marginalised populations more than other populations. Next slide, thanks. Just to give an example of non-communicable disease, so 7 out of 10 of the leading causes of death globally in 2019 were non-communicable diseases. With these changes in the climate and the effects of the changes in the climate, we could see health impacts such as heat-related illnesses, which impact cardiovascular and respiratory health. Obviously, as well, we have the risk of severe weather events and direct traumatic injury. We also have mental effects, as we mentioned. But an example here is that extreme climate and temperature changes can alter food production, which lead to or contribute to malnutrition, which impacts non-communicable diseases, and possibly things like alcohol, smoking, and substance use. Next slide, thanks. A big topic currently globally is mental health, and the developing field of mental health in terms of climate change. So, to give an example here, climate disruptions and disruption of habitats and livelihoods lead to increased stresses, leading to things like forced migration, loss of heritage, and worry about future threats, which impact on mental health. We have different populations who might be more vulnerable and marginalized, meaning the mental health burden is larger. So people who are already on low incomes and already marginalized are already at a higher risk of suffering greater effects as the climate changes. Indigenous communities and populations are often already marginalized, and seeing a loss of heritage, a loss of place can lead to a greater strain on mental health. We know that youth mental health is quite a big issue, and things around eco-anxiety can be really, really quite profound, and that's a developing field of research. And then just to give a specific case example, people with existing mental health disorders are also vulnerable. For example, people who take certain schizophrenia medications are 3 times higher odds of dying during a heat wave because of the medication, making them more vulnerable to temperature changes. So next slide, thanks. We have this myriad of different kind of climate effects and how they will affect public health. But now I'll hand over to Louise, who's going to take us through a few case studies here.
Thank you. So extreme weather and climate events, in 40 years, according to United Nations, weather disasters have actually caused 8 times more deaths than the Hiroshima and Nagasaki bombs. In other words, this means 12,000 severe weather events, 2 million deaths, and $4.3 trillion of economic losses. Now, although mortality over the last century has been decreasing from weather disasters, the intensity and occurrence of those disasters is very rapidly increasing. Next slide, please. Now, in terms of extreme heat and extreme cold, so the IPCC has stated that it is virtually certain that there will be an increase in hot extremes in the coming years. And in fact, last Tuesday, on the 3rd of July, the mean temperature of the planet exceeded for the first time 17 degrees. And this record was beaten again on Wednesday. And unfortunately, it's expected that these records will continue to be exceeded in July and in August. Now, a critical example is the record-breaking heat wave in April in Southeast Asia. Now, in this case, there has in fact been an increase of temperatures of up to extremely dangerous thresholds of 54 degrees Celsius. And there are really a myriad of consequences, but some of these include hospitalizations, power cuts that has had an impact on healthcare delivery, and school closures. And although the full impact of this specific heat wave is not yet fully recorded, last year in India, there was a very similar heat wave that triggered forest fires, which led to an increase in air pollution and also worsened global shortages of wheat, thus undermining global food security. So it's very clear that the effects of these extreme events go very much beyond national borders. Now, in terms of extreme cold, a recent study showed that across 854 urban areas in Europe, over 200,000 deaths annually could be attributed to cold. Now, this is worsened by energy poverty, which is caused by a combination of low income, energy security, high energy expenses, and also the poor energy efficiency of buildings. And in the EU in 2020, around 35 million people were suffering and faced with energy poverty. Next slide, please. Then for severe storms and floods, the IPCC has also stated that they have a very high confidence that there will be more than a double of likelihood in the occurrence of strong cyclones by 2050. There will also be an increase in the frequency and intensity of heavy precipitation, both of which will increase flooding. A really key example in Europe was the 2021 Western European floods. Now, this involved the record daily precipitation in Belgium and Germany, and this was largely due to unusually high temperatures of the Baltic Sea, which brought down humid air to those countries. And some of the consequences of this was that there were over 200 fatalities. There was an estimated cost of 46 billion euros. There was, of course, also severe damage to households, pharmacies, hospitals, and it also disrupted really key health services, including the administration of the COVID-19 vaccine. Now, part of the challenge is that in this specific case, there was a monumental failure of information chain with actually 25 warnings coming 4 days before by the European Flood Awareness System. So the message here is really highlighting the importance of an efficient disaster risk reduction strategy, which considers all affected individuals and communities. Next slide, please. Then in terms of droughts, this quote from the IPCC says roughly half of the world's population currently experience severe water scarcity. So it's a challenge that can very much be seen on a global scale, but one particularly striking example is the droughts in the Horn of Africa. Now, they have been faced with the 6th consecutive below average rainy season, compounded with heat extremes. And over the past 2 years, this drought has led to the displacement of 2.7 million people and killed 13 million livestock. Now, it has also led to other consequences like harvest failures, human conflicts, and also projected health declines, such as in malnutrition. Now, part of the reason this is so striking is that Copernicus stated that climate change made the likelihood of these droughts in the Horn of Africa 100 times more likely. And here I'd like to emphasize also that it is possible and it's important to quantify the direct impacts of climate change, but it's also equally important to look at specific examples around the world and learn from individual experiences to guarantee that also justice is taken into account. Thank you.
So I'm going to pick up on the justice thread there that Louise started. So we can look at justice in a few ways in terms of climate change and public health. The first one is kind of to look at the justice across society from a health equity point of view. We have a lot of data to suggest that environmental stresses affect different populations in different ways. For example, in Europe, there is a lot of studies to prove that people of colour suffer a greater urban heat island and air pollution exposure risk. So, we can look at justice from that point of view, and that different people are affected, and we need to protect everyone together and make sure the most vulnerable and marginalised people in society are protected, because we can't leave anyone behind, and that's part of our just transition. We also have the view of international justice, in that a lot of places, regions, countries, people who have contributed historically the least to climate change stand to suffer the most. We're talking about parts of sub-Saharan Africa, low-income countries, and also the low-lying island states, which face an existential threat, really, from climate change. We have data from the IPCC to say that 3.3 to 3.6 billion people live in contexts that are highly vulnerable to climate change, and to the effects of climate change, such as mortality from floods, droughts, and storms, which are 15 times higher in highly vulnerable regions. We can also look at justice from an intergenerational point of view. By 2070, the IPCC says that 3 billion people live in uninhabitable zones, mostly in low-income countries. But if you're looking forward 50 years to 2070, most of the people who will be dealing with these effects probably haven't been born yet. So we can look at it from that point of view as well, that we have to think about the justice issues with people of different generations, and the legacy we leave behind, really. Next slide, thanks. We also just wanted to touch on public health and kind of what we can do in public health to push these messages, to advocate around these messages, because communication, not so more, is, as I said, about convincing people. It's about kind of showing what needs to happen. And we also have a challenge in that we have to communicate the depth and complexity of public health risks and effects, because this is something that is not seen really necessarily in the extreme breadth that it will affect our societies and our public health. But we also have to communicate in innovative ways that are engaging and that motivate change instead of being doom and gloom, which is such an issue as well, because there is a lot of information out there. Next slide, thanks. Just to touch on as well, we ran a recent communication workshop in EPHA where we looked at innovative communication techniques and how we can take public health messages and make something new out of it. So we did a few different exercises, and some of the brainstormed activities included a TV talk show with reducing meat consumption and kind of cooking, child-focused media around climate change, an interactive game where you plan your cities, and digital installations where people are made aware in places they frequent of dangers of different things such as air pollution and medical waste. We also used a bit of AI, and you can see some pictures here we produced where basically the Grand Place in Brussels is affected by climate changes and it has become a beach. So next slide, thanks. We're going to move on to our first speaker now. So our first speaker is Dr. Vladimir Kandrovsky. Dr. Kandrovsky is a medical doctor and specialist in hygiene, environment and health, working as a technical officer for climate change and health in the WHO Regional Office for Europe in Bonn in Germany. He assists member states in development and implementation of policies in relation to climate change, extreme weather events and health issues, and promotes training and national capacity development on climate change and health. So today, Vladimir is going to give us a bit of an insight into the work of the WHO Europe Bonn office, some public health issues we're facing in the region and what we could do. So without further ado, I'll pass over to Vladimir. Are you there, Vladimir, in Bonn?
Yes, Kyle, thank you. And good morning, everyone. And thank you for being here today. Thank the organizers for the invitation and opportunity to participate in this webinar. So I'm here today to talk to you about WHO activities in advising health and climate change in alignment with the global and regional WHO initiatives. Yes, addressing climate change in an equitable manner is crucial to protect the health of vulnerable population and to reduce the health disparities and promote sustainable development. Thus, today, I will focus to health system and healthcare facilities, as they are our first line of defense against climate-related shocks and stressors. And at the same time, the operation often impact the environment and population health. Next slide, please. Yes, this slide is complementary one to the one showed by Kale. But in nutshell, I would like to highlight the global problem we face, because the signals about what human activities have done to the environment are becoming increasingly shrill. And the left-hand side figure show the increase of the global temperature, and you can see that each decade in the latest 50 years is hotter than the previous one. So we have already reached 1.2 degrees of global warming. And as you see in the right-hand figure, we already we are not capable with this commitment to reach the Paris target. So in order to limit our warming to 1.5 degrees Celsius, our emission need to drop by 45% by 2030, or to decrease the fossil fuel production by roughly 6% every year between now and 2030. So that means that we have to increase the level of our ambition and to act now. Because regarding the health issue and the latest evidence from IPCC recognize that the consequences of 2 degrees world or warming is substantially worse for human well-being than 1.5 degrees. So we still need to keep our ambition to cut as soon as possible. Next slide, please. Also, I will focus now in our WHO European region, which is consists of 53 member states and with around 800 million inhabitants. As we know, all the climate change is resulting in poor health outcomes. It increased mortality and is a driver of health inequities, because it affects our health and well-being in many ways, as we see. So heat waves drive excess deaths. I will recently, just 2-3 days ago, the new Nature manuscript highlighted that 2022 summer in Europe caused 60,000 deaths. So the estimation is that only in 35 member states of WHO European region, more than 60,000 people died due to heat. And it was as it was mentioned, the hottest summer ever recorded in Europe. But also, we saw also in the previous presentation that extreme cold drives cardiovascular and respiratory diseases. In our region, in particular in Europe, the floods and storms are the most prevalent cause on recording disaster. Floods with around 40%, storms with 30%, but the extreme temperature accounted for the highest number of deaths, with around 93%. And the long-term risks to health are systemic and hard to quantify, but definitely vectors of diseases shift into Europe as temperature rise and increase in food and waterborne diseases are recorded. We saw the droughts are also relevant for Europe and the water scarcity, in particular in south part of our region, because they threat water supplies and agricultural productivity and undernutrition. Of course, we have to be aware that consequences for health of lost work capacity and reduced labor productivity in vulnerable population is expected as well. When we are coming to vulnerability, of course, we have to highlight that the children and the elderly are more sensitive to extreme temperature and more likely to fall ill compared with others. Also, poor households cannot protect themselves from extreme heat or cold and cannot afford to repair damage after floods. So most conditions favor mouth and respiratory illness. So it needs to be taken into consideration the collective efforts to support the most vulnerable. And just to mention the full poverty, which is relevant to poor households, which use dirty fuels to heat their homes, which pollute the both indoor and outdoor. So in nutshell, climate change exacerbates existing health inequalities within the European region. And to be fully aware what the war in Ukraine or socioeconomic factor as income inequality, social exclusion, and others, which is connected with big inflation, definitely will affect the most vulnerable in our region, and they contribute to differential vulnerability and resilience to climate change impact. So disadvantages population face a higher burden of climate-related health risks and have reduced capacity to adapt and recover from climate change impact. Next slide, please. We also hear that climate change is already impacting health in myriad ways, including by leading to deaths and illness from increasingly frequent extreme weather events, such as heat waves, storms, and floods. But there are no good news for the future, because climate change is projected to significantly worsen the current situation. And the number of extreme weather events has increased by a factor of 5 over the 50 years period in European region only. So we will expect more frequent, more intensive, and more extreme weather events like heat waves, and they will last longer. Next slide, please. Yes, definitely climate action represents an opportunity to harness synergies and to improve the healthcare services and infrastructure. So the three main tasks for the health sector. The health sector needs to adapt and become resilient to climate change and protect health from full range of rising climate risks like extreme weather events or infectious diseases, and to reduce the fossil energy and greenhouse gas emission from material manufacture and transport, because the facilities can reduce fossil energy use via green building and landscape design, for example, and then to contribute to the mitigation efforts. So next slide, please. So the health sector is responsible for almost 5% of global greenhouse gas emission and has a carbon footprint equivalent to more than 500 coal-fired power plants. If the sector were a country, it will be the 5th largest polluter on Earth. And under a business as usual scenario, emission from healthcare could triple between now and 2050. So more than 70% of emission from the healthcare sector primarily derived from the healthcare supply chain, the production, transport, use, and disposal of goods and services that the sector consume. So the climate resilience and environmentally sustainable healthcare facilities can be defined as those capable to anticipate, respond to, cope with, recover from, and adapt to climate-related shock and stress, while minimizing the negative impact of environment. So these climate resilient, environment sustainable healthcare facilities can contribute to the higher quality of care and accessibility of services, and be helping reduce facility costs and ensure better affordability, which is very important, because this is the tool how they're therefore important complement of universal health coverage, which is the way how can bridge the gap of inequality. That's why the WHO operational framework on building climate resilience health system fit for this century. and it was launched to guide the member states to systematically and effectively address and increase challenges posed by climate variability and change. So here you can see in the circle figure the 6 building blocks of the health system, and there are important starting points for building overall resilience of the health system to climate change and strengthen existing health system capacity. So therefore, the operational framework covers, as I said, all 6 building blocks, and it has 10 components. They are shown in the outer ring of the figure. And of course, there are many examples for each of them, but I'm just to give you that this is the only screenshot and on the how to manage, and they are available in on our WHO website. Next slide, please. Of course, we provide information to our member states on how. We have these guidelines on climate resilience and environmentally sustainable healthcare facilities. And its goal is to increase the climate resilience of healthcare facilities, to protect and improve the health of their communities in an unstable and changing climate, while optimizing the use of resources and minimizing the release of waste by becoming environmentally sustainable. Of course, the objective is to guide health professionals working in healthcare settings to understand and effectively prepare for additional health risks posed by climate change. And as depicting the figure, there are 3 objectives under each of the 4 fundamental requirements to provide safe and quality care that are central to the action framework. This focus specifically on healthcare facilities and expand the scope of the role to include environment sustainability. So we describe why we need this and how we can reach this. Of course, WHO support member states in building capacities to the way how to manage and shortcuts towards more effective way of implementation. Because a set of potential intervention health sector decision makers can employ to enhance both climate and resilience and environmental sustainability are available in these guidelines. So, but for this, we need the policies. Next slide, please. So we start to lead and to engage the healthcare professional, in particular towards the COP26, and by establishing our health program, established by WHO together with the partners, and we invite countries to make commitments to increase the resilience of the health sector and to reduce carbon emission from healthcare. Because for us in WHO, the future of health system, as with all systems, has to be low carbon and has to be resilient to climate impact. So this COP26 health program evaluates to the new WHO initiative since last year, the Alliance for Transformative Action on Climate and Health, ATTACH. We call this ATTACH Alliance, which works to release the ambition set of COP26 to build climate resilience and a sustainable health system by using the collective power of WHO member states to drive this agenda forward, of course, at pace and scale, and promote the integration of climate change and health nexus into respective national, regional, and global plans. So we have, by June 2023, we have 70 countries committed to building health system, which are able to withstand the impact of climate change and which are low carbon and sustainable, but also Among these 70 countries, 23 countries have set a deadline of 2050 or earlier, by which their health system will reach net zero emissions. So this is one of very important achievement, and we it is open call for other countries to join to this initiative. Next slide, please. Yes, this is the one. Please, next slide. Yes, and in the European context, we just back from the 7th Ministerial Conference and on Environment and Health, which took place in Budapest from 5th to 7th July this year. And in this conference is defined the future environment and health priorities and commitments for the WHO European region, with a focus on addressing the health dimension of the triple environment crisis of climate change, biodiversity loss, and environmental pollution. It successfully concluded the 7th of July with the adoption of the Budapest Declaration. The conference has drawn over 600 participants from 46 countries, with many ministers and deputy ministers, and it was a testimony to the crucial importance of this topic. So we try to make under this framework of commitments which are aligned with other global commitments, but giving the European flavor and prioritize the country needs. Because under this big conference setting, we have another initiative specific for our European region in the activities under the Working Group of Health and Climate Change of the European Environment Health Task Force. This is the HIC group, which serves as a platform for preparing the contribution, and which also developed the background climate change and health document, which can serve as a role model across the region and support the formulation of key health messages for this ministerial conference. This is the zero regrets paper you can see in the central part of the figure. Next slide, please. This paper, and you can see some of the authors from different countries, but this paper is aimed at policymakers, particularly from the health sector and civil society representatives, with the intent to raise awareness about the links between health and climate change, and introduce the 10 asks. Some of them are there in different colors, and in fact, they intend to strive for net zero by 2050 and accelerate resilient, sustainable, inclusive transition. We strongly advocate to an unsiloed climate change and advocate for climate change as an integral policy consideration in the health sector and vice versa. So one of the accelerator of the commitment, next slide please, of the ministerial conference is, as we call, EPHA partnership, which is led by Ireland. And you can see here our regional director, together with the State Minister of Health of Ireland, how they signed this partnership, and a few countries like the Netherlands, UK, Belgium, Norway, Austria joined this partnership. Because with this backdrop of the ministerial conference, it highlighted the regional initiatives and advocate for collaborative partnership on climate change and health across countries and stakeholders to leverage the resources, expertise and knowledge, and leading to the more effective and impactful outcomes. And you can see this partnership main area of discussion work for the coming year. So we sincerely hope that it will accelerate the commitments taken by the Budapest conference. And next slide, please. Yes, as a conclusion, this is my last slide, but I'd like to give you a few take-off messages and highlight that climate change is here and now. Its consequences become more and more real, but the health sector definitely needs to walk the talk to become climate smart, climate resilient, and environmentally sustainable while ensuring essential services. This is not an additional burden. This brings health benefits and safeguards quality of care, definitely. Convening initiatives to different policy domains, we have to handshake is needed between healthcare, health system-oriented processes, and climate environmental-oriented processes. So it should go hand in hand. Thank you very much.
Thank you, Vladimir, for setting the scene and for your input also on the importance of course, adapting the health sector to becoming more resilient. It was also great to hear about the outputs of the 7th Ministerial Conference last week. I would now like to introduce Laurent Chambaud. Laurent Chambaud is the former Dean of the French School of Public Health, a public health physician, and also former advisor to the French Minister of Social Affairs and Health, Marisol Touraine. Laurent has also received last year the ASPHER Award, which is the Association of Schools of Public Health in the European region, to recognize his outstanding achievements in public health teaching and practice. Hello to Laurent in Paris.
Hello, do you hear me?
Yes.
Is it okay? Okay. So firstly, thanks a lot. And I would like to thank the organizer for inviting me to this webinar. It's quite difficult to speak after you, Kel and Louise, and also after Vladimir, because you have said a lot of things. So I would like perhaps to focus my presentation on the role of School of Public Health, of course in Europe, but also this role will remain the same in all the countries. I would like to speak about three main things. The first one is what is a challenge on research, how we can better know. So you, Kel, Lois, and Vladimir, you have said a lot of things about the direct and indirect effects of climate change on health. But I think that we have to go on. We have to develop research, perhaps to better know exactly what are these direct and indirect effects, and perhaps also to be able to show to the different stakeholders and the population what is exactly the main threats that we will face. And I would like also perhaps to stress on one thing that has not been perhaps said, that has not been said by the other presenters until now. I think that we will face something important on the information system. That means that we will need to design and also perhaps to monitor some information that will follow what will happen in the next years. So it's something that has been also developed by different organizations like the European Climate Change and Health Observatory, or by the Lancet Countdown. But perhaps we have to make a synthesis of that. And I think in terms of research, we need also to design something that will be robust in the next years. And for that, we perhaps need the School of Public Health to liaise with the International Panel on Climate Change, the IPCC, but also with the Lancet Countdown and the Observatory. So it's perhaps one thing that we have to do. The other thing is that I think that we also have to better document the impact of climate change on health inequalities and inequities. So some examples that have been done previously, but my feeling is that we have not enough knowledge and scientific evidence on that, and we need to document health inequities, health inequalities, and the effect of climate change on these inequities more and more. Within research, the third thing I would like also to say a few words on is about the definitions of the different concepts and terms, because we have a lot of things that of words. Let's say we have, of course, climate change and health, but we also speak about environmental health, and Vladimir just said that there was this conference on the environment and health in Budapest. We have the One Health concept. We have global health, planetary health, and I do think that it would be important just to clarify for everybody, for the professionals, but also for the population, because those definitions are so close one to the other that I think that we need to perhaps have a discussion on that, and perhaps the School of Public Health can lead this discussion. So just to say that on research, this requires very active interdisciplinary research, and this interdisciplinary research can be conducted, of course, at the national level, but we know that now that research has to be conducted at a very global level. That could be European level, but it's also at the international level, and the School of Public Health have to take part in this research activity. The second point is on training, how to be better inform and disseminate knowledge. Our role as School of Public Health, of course, is to train public health specialists and professional public health professionals. So let me just give you two examples that ASPHER is conducting now. The first one is a very huge work that is ongoing, is to revisit the core competencies in public health globally. So this is something that we do now, and we hope to finish this revision at the end of this summer within a meeting in Dublin, in Ireland. And within this global revision, there will be something very consistent on climate change and health. So it will be part of the competencies that the public health professionals will have to acquire in the future, and I think it's really something important. And the second example is that we in ASPHER would like to develop a virtual course. It's a course that has been already developed in US by the Global Consortium on Climate Health Education, which is led by people in Columbia in New York. So last year, they have set up a virtual course on climate change and health. And we plan to develop such a course for and tailored for the European region. And it will be in close collaboration with the Global Consortium. And we hope to open this course, perhaps we hope to open it the beginning of next year in January or February. The second point within training we don't have only to train public health professionals or public health specialists. We also need to train the health professionals and the healthcare managers. I was very interested with what has been developed by Vladimir about the healthcare system, because I think it's something that will be a real challenge in the future, because the healthcare manager and the healthcare professionals, they will have quite a dilemma, because in one hand, they will have to face and to cover the new health needs of the population, which has already evolved if we consider what were the health needs in the 20 years ago. And in the future, the health needs will evolve with the impact of the climate change on health. So they will have to be ready for this to cover the new health needs of the population. But in the other hand, as Vladimir just said, the healthcare system has to mitigate its own carbon footprint. And how we will deal with that, I think it will be really a challenge, and we need to train people to face this problem. And to give you an example, so Vladimir just said that the global carbon footprint is around 5% of the total carbon emission. In France, it's 8%. So we have really to tackle this point. Looking at training, the role of School of Public Health is also not only to train public health professionals, health professionals, but also to inform all stakeholders and policymakers, as you do in EPHA. But we can perhaps also sustain this. At each level, we have to work at the local level, at the national level, at the European level, and of course at the international level. And for School of Public Health, it's a challenge because it's not strictly speaking training. It is more to develop a basic awareness on how to diminish or to mitigate the impact of climate change on health. So it's really something that in which School of Public Health have to be open to the stakeholders and to the policymakers. And the last role is on advocacy and mobilization. School of Public Health, I do believe that we have to contribute to the general dynamics, which is an academic dynamic, a scientific dynamic, but also a citizen dynamic. And this can be done perhaps by three main means. The first one is by developing and disseminating some statements. For instance, we have, as ASPHER, lead a statement. It was last year in May 22, and it was presented at the European Union Health Policy Platform. And the title of this paper was "Moving Towards the Right to Health for All by Training the Public Health and Wider Health Workforce on Climate Change and Health." So this is something that we have participated in, and as ASPHER, and I think that we have to continue to go on that and to develop several statements because the situation will require that. And sorry, another way to mobilize and advocate will be also, I think, to develop case studies about positive experiences which succeeded in facing the challenge of climate change on health. It's what you do with this webinar today and with the roundtable that will be just after. It's also what WHO and the European Observatory on Climate Change and Health is doing. And we, as School of Public Health, I think, have to participate to these case studies. It's really important because, one, it shows that priorities can be different, depending of the local situation, of the region, or of the country. And it also allows to share some experiences between different localities, different countries, to compare. It's always important and useful to compare. And also it could serve to define some common tools. And the last thing, and I think it's really also important, to develop such case studies, it gives hope. We know that we can do something, that we are not facing the fatality, but we are able to tackle this problem and to have some positive experiences. And the third thing concerning mobilization and advocacy is also to be present and active in national or international events. And Vladimir just spoke about the Conference of Party. I think that the School of Public Health have to be present on the Conference of Party. So I think it's something that we need to do, and we have to be present to the next one in Dubai. Just a little thing that has not been said until now, but I think that we have also to elaborate on the ethic approach. How we can have an ethic approach of this problem of climate change and health. And it's really an open box. I don't want to elaborate on that because it would be too long, but it's something that we don't, that we have to take into account. And my conclusion is very simple. Climate change and health is a very new and demanding challenge for School of Public Health. But it is also an opportunity to reinvent public health. And it is what we will do, what we have to do together. Thank you very much.
Thanks so much, Laurent. That was extremely useful and inspiring. Thank you. I like the addition of, or the inclusion of hope in there. That's a very important factor. And I also appreciate you mentioning ethics as well. It's extremely important. I totally agree, because on the parts about research and collaboration and communication, that's how we're going to push forward our messages about the seriousness of the public health impacts. And previous colleagues that I've worked with in public health medicine, we talked about how, especially like in infectious disease risk, how we can start capture the climate change impact on the cases of infectious disease we're seeing, just as an example. So, and I think that what you said about quantifying those risks, it does add a lot of weight to what we say and how we communicate and how we kind of get across those sorts of public health effects. So I think that's extremely useful. So thank you for saying all of that. Much appreciated. And funny you mentioned Dublin in Ireland as well, because our next speaker is coming from Dublin in Ireland. So we're going now to Dr. Ina Kelly, who is a specialist of public health medicine in the Health Service Executive, the HSE, in Ireland, which is the National Health Service. She's a board member of the Irish Medical Organisation and chair of HSE Ireland Public Health Medicine, Environmental and Health Group. She started a new role in the HSE just recently as lead of health protection, the Health Protection Surveillance Centre in Dublin. She'll be giving us a bit of a national perspective on national kind of public health risks in Ireland and how we can act on public health in a national setting. So hello to Ina in Dublin.
Thanks very much, Cale. Actually, I'll be leading on environment and health, not the whole of health protection, but obviously I'll work with everybody for that. Thank you very much. So maybe the next slide, please. Yeah, so just to set context, and I know that Vladimir and Laurent have already done so, but and so have you, Cale, and Louise as well. But just to say, I suppose, starting with this, I suppose to think about the whole world, we are all going to be impacted by climate change, and all of the severe weather effects are going to impact on our health throughout the world, and we all know this. And I suppose then it really comes back to a small country like Ireland, even though we may get some milder effects, say from extreme heat because we're a bit more north, but we do get floods, less likely hurricanes at the moment and so on. But then I suppose we have to think about how it will impact us in other ways. And I'll go through that as we're going along. Next slide, please. And of course, the main thing is the tipping points. We don't know what's going to happen with any of those. We don't know whether we've gone into any tipping points at the moment and where we're going to get some escalation of climate risks. But that's something I suppose we just have to keep watching and modifying our actions in relation to that. Next slide, please. So I think one of the big things, and looking at the first slide there about the world changes, countries that aren't going to be so impacted so seriously, which may be or may not be Ireland, for instance, are going to be probably places where maybe if we're going to lose so much of the global and planet habitability, we're going to maybe necessarily receive people and may have to share our space with people and be able to provide, equality and equity in relation to our services to people as well. So that's something that I think each country needs to be thinking about too. We know that we're going to have a large numbers of people, were talked about in previous presentations, that we know that there are going to be many people who are going to be faced with inability to live in the places they come from. And so we're going to expect large numbers of migration, of people migrating. We may be already seeing some of that. I'm not sure that we're attributing it yet. We're not really necessarily going out and working out, what started the journey for people, and are there people going to come with them because are they able to manage? Why do they leave and so on? But I think we all guess that there's an awful lot of climate migration already starting. It may not be your refugee situation yet, but it could be for some people. It could be. The EU Parliament did do a discussion paper in the last few years on this. And I think their recommendations were we definitely need to support vulnerable countries in the first place. So most people love the country they come from, and we need to make sure that we need to try and help those countries to adapt themselves so that they don't get the impacts of climate change that they're currently experiencing. And obviously we need to be doing joint research so we can watch what's happening. And then of course we need to be thinking that we are going to get many climate refugees, and we need to have a legal framework for them, because at the moment they are, it's perilous situations, I would say. If we don't exactly know why people are moving, but we know that the links between climate change and civil unrest and displacement and movements of people, which I think multi cause movements. And I think we need to be ready for it. We need to be preventing it as much as possible, but in an ethical manner. And we need to be going back to, we have a huge ethical obligation to prevent changes caused by our emissions. And we haven't really come to terms with that yet, I don't think. Next slide, please. So in Ireland, really looking at the sorts of things we're likely to get: some heat waves, storms, more storms, which we get plenty of, floods and drought. These, we have to think about the impacts of all of these on our health. And next slide, please. And like, for example, temperature, we are expecting warming extremes to rise. I mean, they're less than probably a lot of mainland Europe. We're a little bit more north. And, but we would have cold-related mortality, but we're expecting that will be reduced, but we're going to be offset by increases due to heat stress in the warmer summers. And I noticed that most recent article that came about 2022 deaths, there was no available information from Ireland. So that's something we're going to have to deal with within Ireland. Next slide, please. We're expecting decreased rainfall in summer, but we're going to get more in winter. And so we have to deal with both the extremes, which again in Ireland with a temperate climate, we don't really have that much extreme, and we're going to have to, our engineering is going to have to adapt to it and so on. Next slide, please. Sea level rise. We're an island. Obviously, we're going to get increased erosion, coastal erosion, flooding, and damage to property and infrastructure. And when we write damage to property and infrastructure, that means people's lives and livelihoods are impacted. And of course, people can't afford to lose their house. They can't afford to lose their farm or their business or so on if they're close to, the coast and they're being flooded there. And, insurance hasn't caught up with the risk, and we haven't set up an insurance system to help people. So people who are frequently affected, and they lose their ability to actually have an economic life there close to the coast as well if they're impacted by flooding. erosion and so on. Next slide, please. So this is an old slide that I did years ago, and I see some much nicer ones in the previous presentations. But this is just for me in my daily work, public health risk assessment, looking at on the left the changing climate effects and how it affects weather, and the environmental effects. That would be me thinking about how it affects people in Ireland, and particularly because that's my duty. And then looking at the health impacts on the right. And they're all been mentioned already before, but they would be, these are the sort of things that I need to be developing in my new role in relation to climate epidemiology. We need to be looking at starting to put some numbers on the sorts of impacts that are affecting people. Next slide, please. Okay, like in Ireland, for instance, we have to think about our existing vulnerabilities, and we have the fourth highest prevalence of asthma worldwide, and like the pollen season increase may increase exacerbations, for instance, with zoonotic gastrointestinal illnesses. We're the EU leader on STEC and cryptosporidium. We have a very large minority of our population exposed to untreated drinking water. And they're not properly constructed. We have a large reservoir of cattle and sheep who are the reservoir, the reservoir of STEC and cryptosporidium. And we have lots of high groundwater vulnerability with an awful lot of karst in our landscape as well. And winter flooding, of course, with the climate change may increase the contamination and illness that we're exposed to. So then also many people in Ireland with a fair skin, the type that burns easily, and and doesn't tan properly. So we're at risk, maybe at higher risk than many countries, of UV damage and skin cancer, with 13,000 cases in the Republic of Ireland every year. And I think in Ireland's behaviour, I was looking at Gail's lovely AI slide there of the Place in Brussels. In Ireland, people would say, lovely, we want to be, because people love going to the beach and we don't get an awful lot of sunlight. So people misuse, they get burned in summer and they go out and get burned again and again. People are inclined to go on summer holidays to get more light exposure, but actually obviously get more UV exposure as well. Next slide, please. Other predicted impacts would be like, I think we have the disrupted power transport communications were mentioned, and get flooded EDs. We've had that a few times in different hospitals in Ireland already, and we've no register of critical infrastructure failures of adaptation or failures of resilience. So we're going to have to do something about that to try and capture those incidents that happen, because I think as Vladimir was talking about the climate smart healthcare force. Mostly people don't see that at the moment, and we've a bit of work to make sure to see that if something happens like that, that they see, oh, that's a problem in relation to climate. Overheated hospital, for instance, as well, that's an issue that obviously during heat waves, we need to make sure that our hospitals are cool enough for our patients to be able to recover from heat stress, for instance. And I think that's not barely on our agenda yet. Now I'm trying to do something about that, of course. Vector-borne diseases, again, we're watching. Ireland's probably more likely still at the moment to be having cases come back from holidays with vector-borne diseases. Climate disruption of destructing habitat and livelihoods, and that's, I suppose, unbearable stressors that cause anxiety, depression, and suicide. So we have to be watching for that. We're not measuring those things yet. Next slide, please. So what are we doing in Ireland? Next slide, please. Okay, with the mitigation side, we have a climate action plan, actually. So you can see we have one, and it's every year now we're revising it. So that's something that's happening. And so the mitigation actions are all described under power renewables, to building better, transforming how we travel, making family farms more sustainable, and green business and enterprise. Now, I would say looking at our land use, so that's a huge area of contention. And I think this is where the climate justice we're not tackling that at the moment. But if we're asking farmers to stop doing things that they feel they've been trained up to by EU policies in relation to common agricultural policy of becoming more intensive, which of course, and that's where they've been getting their funding. The funding isn't coming yet to make things more, to make justice, going back to maybe re-wetting of wetland, boglands, peatlands, I think they're called, and re-wetting, that type of leaving areas for flooding to capture and carbon capture of our peatlands as well. Those things haven't really been properly sorted, so that farmers, they are understandably slow to want to change. Next slide, please. the national adaptation planning has been going on for some years because we've had statutory obligations to do so. So there are lots of areas included, and some areas are ahead of others. Health has been slow to do it. COVID, of course, slowed us down as well. But I put some areas at the bottom. Housing isn't even included in this. Foreign affairs, justice, for migration, for instance, and finance. Next slide, please. So the health sector actions to date, we are doing, I've been involved in a lot of this, and some of my colleagues have been helping us with this advocacy and collaborative work. And we have been doing public health risk assessments and advising other sectors for quite some time. But it's a slow action, and this is where I suppose health in all policies, we haven't really adopted that formally in Ireland. So I feel like I'm trying to push health in all policies, but without really the demand for that yet. That's maybe an area public health needs to get more involved in. We have an adaptation plan now, but COVID's slowed the implementation. But now we have a climate unit in the Department of Health and in our Health Services Executive. So we've got a new climate unit and a new strategy, which has been just launched in June for the Health Service Executive, which is the big, public health sector in Ireland. And if it doesn't provide every service, it sort of commissions the rest of them. So we are now in a place where we can actually start doing the right things. We have a health protection strategy as well, which also acknowledges that there is global health, which includes climate change. And an area in which I lead are hazards related to the environment as well. So we have now got the mandates are coming to us to help do the work. And next slide, please. Thanks, Kate. So the implications really are going to affect all of public health, because I work in health protection, for instance, but health improvement is more about the prevention side, but maybe, in many settings, health intelligence, the data, health service improvement, about improving our health services. And I put in a lot of their sort of issues that we need to be thinking about. And, obesity is another one, but maybe is more of a byproduct of our dysfunctional food system, for instance. I've mentioned demography, child health, children, the future. I think that's already been mentioned there about intergenerational obligations to our children who have no voice really, and so on. And I'll move on. Oh yeah, increased need and demand. Again, I think that was mentioned about the changing health needs that we will have. Next slide, please. Okay, climate epidemiology, again, an area in which I don't think we're quite ready yet. I'm starting to make some efforts now to work with other colleagues internationally on this, about classifying. How do we classify deaths? For instance, during a 2015 flooding events that we had in Ireland, the National Emergency Coordination Centre were saying there were no deaths, but actually there were some road deaths where people maybe slid off the road into a flooded ditch, and it was a road traffic accident and wasn't classified maybe as a weather-related death. Attribution, there's a lot of work to be done in that area. So we've got to, we have to keep working on this now. But if we don't measure baselines and we don't measure trends, we're dealing with, lack of data is not helpful in developing policy and persuading people. Next slide, please. Justice then. I mean, this is all about justice in the long run, isn't it? And, our homeless people, our underserved communities, they get very little from our societies in many ways. That's why they're in that situation. They get very little of what they need. And many of them are voices, particularly children, but so are many others as well. And so I think climate change has really pushed us. It's going to make things worse for everybody, and especially everybody who's already underserved. But I suppose there's the opportunity for public health to really drive the rebalancing. So we move to the next slide, please. So the barriers really, I think, I think in public health, we're very small and we're all overworked a lot of the time. So lobby groups, a lot of money in lobby groups going in the opposite direction, powerful interests who don't really want to change. I mean, I think our dysfunctional food system, for instance, there's, in Ireland, it's really into, big agriculture, animal food and all of that. And there is a sort of an ignoring of the adverse effects of it, a lot of greenwashing. From the public, I think they're afraid because, and I think there's an inertia, I don't know which way to act, and maybe we have a lack of maybe positive messaging and how to do things. And there are lack of resources put into, say, public health, for instance. That's what I know most. And then I think there's an unclear path to a just transition, because really, if you're not even showing the destination, then how can you ask people to come with you? So we've got work to do in communicating that clearly. But our opportunities, the science is definitely showing us what we need to do. The population is getting more interested and demanding changes. I saw in Ireland, particularly, great solidarity during COVID-19. So there's a huge goodwill to tap into when we persuade people and show them the benefits when we can do that, and try to develop the benefits as well. And a lot of that is policy. External drivers, I think the EU drives in Ireland particularly, if legislation helps to make to focus minds at government level. And in public health then, we've got this ethical obligation to everybody, globally and particularly within our own country, to look after our population properly, and especially those who need it most. We also benefit from trust, I think, and that's something that was hard to win and easy to lose. So it's really important that we maintain trustful relationships and trustworthy relationships with our public. Collaboration, we collaborate with many and can do so, and have lots of that's how we work really. And we have lots of potential solutions. And I think we can also provide backup support for decision makers. I remember when the smoking ban, and I think Ireland might have been the first country to bring in a smoking ban, when the public health was able to support the minister who was making a very difficult decision in Ireland to say we're going to ban it in pubs, for instance. In Ireland, we love our pubs. And so for the year and a half really beforehand, we had a few different people who were willing to be called at a moment's notice to get on the radio and say the minister was doing the right thing, which is terribly important. And then the next, what I haven't put on this slide, is health in all policies and health impact assessment, as the World Health Organization recommends. We don't really do this well enough, but I think this is a really open door for us now to start bring these in. And last slide, please. Okay, so I think in conclusion, we all agree profound effects of climate change are impacting and will increasingly impact on human health. In Ireland, just as a case study, we're challenged even in providing basic needs. We don't have housing for everybody. We're not able for climate migration because we weren't able for migration, say, from Ukraine. And, we have some poor people coming into the country who are left sleeping on the street. I mean, that is just shocking. And we don't accept it in Ireland yet, but our political system is sort of not fixing it. Clean water, healthy food, they're all issues we're challenged in that regard yet. And we do need urgent action, but we have the science, trust, solidarity, and I think maybe increasingly strong public health leadership to start tackling these challenges and maybe provide support to others who we need them to do it. We can engage with everybody. And I think this is really an opportunity for health in all policies. So thanks very much.
Thank you, Aina, for a really engaging presentation. You really covered a lot of great points, and for bringing up also that, of course, with reduced global habitability, it will drive forced displacement, and if not addressed properly, it will increase disparities. Also great to hear the progress across Ireland sectors and how there is still very much a long way to go in many of them. So now for our next speakers, we will move outside of the EU with representation from the Western Balkans, Caucasus and Central Asia. And we will start with Stevan Savic, who is a full professor at the University of Novi Sad in Serbia. He has more than 15 years of experience in education and sciences with climate change. And then the last 12 years has focused his research more on urban climate issues and particularly urban thermal conditions. So hello, Stevan.
Hello, thank you for a nice introduction. Okay, in the few slides, I will present some short explanations about the climate change, urban climate and public health in Serbia and also in Western Balkans countries, or I can say in the region. Next slide. Most of the Western Balkan region is the continental climate. We have some mountain climates and also this Mediterranean near the coast, but most of the cases are covered by the climate, continental climate. And of course, when we talk about the climate change and climate hazards, we can talk about three situations. We have floods, fluvial or river floods, because some parts of the years we have a lot of water and a lot of precipitation, but also in some other parts of the year we have extreme droughts, some periods without precipitation or very low precipitation. It's mostly the summer and autumn months, but also very important climate hazard that we experience here is extreme heat conditions, and it's mostly in the summer months, but more and more we have in some other seasons, particularly in autumn or late spring. And these thermal conditions is people are very sensitive on this thermal condition, particularly during the heat waves. Next slide. Of course, when we talk about the thermal or temperature conditions in the region. You can see here, according to some models, the temperature will increase 1.2 degrees Celsius in the next 20 years, but also according to the models, these better or worst scenarios, the temperature can rise by 1.7 to 4 degrees Celsius until the end of the century. But it's, of course, it's not 100% sure, but we can expect this kind of situation. Next slide. And of course, when we talk about these better and worse case scenarios and related with temperature change, you can see a few maps with different situation. This first line is until the 2040. You can see that this temperature will rise in any case, and the last map in this first line is the maximum temperature. The second line is until 2070. We can see that the rising will continue, and the last line, the third line, is until the end of the century. We can see that the rising of the temperature will continue, and it would be quite significant, particularly the maximum temperatures. It means that we can expect more heat waves, but not only the heat waves, we can also expect more and more hot days, that days with maximum temperature of 30 degrees or more. And if we know about what is the current situation and what we can expect in the future, next slide, we also can try to compare what about the public health, this climate change and public health situations. This graph is representing 16 cities across the globe. Those cities are from different continents, different climates. But we can see very similar situation. It means that if we have the temperature 25 or more, then this heat mortality risk starting to rise. But in some cities, because obviously that's in some climate, that boreal climate or maybe some very hot climates, people use on some higher temperatures, particularly this subtropical or tropical. But almost in all cases, if we have 30 degrees or more, then we have this heat mortality risk that exponentially rising. That obviously that 30 degrees is some limits that for the public health could be very risky. Next slide. Based on that, we try to make some our analysis based on our monitoring on the field. We are mostly focused on the cities, and in the last few years we had some measurements and monitoring in the urban area of the Novi Sad. It's the mid-sized European city, about 300,000 people. This is one analysis from 5 years ago. We tried to make a new matrix based on the average daily number of deaths in Novi Sad and temperature differences between urban area and natural area. It means that we didn't use the absolute temperature data, we used the values of differences between the urban and rural areas. And based on that, we created this matrix and this risk level scale. And you can see two maps. These are two very intensive and strong heat waves in Novi Sad in July and August 2015. And you can see that this very high risk level is covering the most built up area of Novi Sad. It is in the same time the most populated area of Novi Sad, and obviously that this kind of risk could showing that these temperature differences can affect on public health in general. In this analysis, we use this number of deaths, but also in the later we also see that this hospital admission is also very important, and that climate had effects on these numbers. Next slide. Yeah, this graph presenting relation about hospital admission and maximum temperatures. We didn't analyze the heat waves. We just analyzed the days with maximum temperatures. And in this case, we tried to see how is going the hospital admission related to changes of the temperature day by day. But we use only the maximum temperature. And we saw that if we have a higher values, it's mean between 6 and 10 degrees Celsius, then hospital admissions start to rising. What is between 5 and 10 degrees Celsius? It means that the differences between 2 days, differences of maximum temperature between 2 days, if it's 10 degrees Celsius, also we can expect in that day and next 2 days also the rising of hospital admissions. It means that people are not only sensitive during the heat waves, but they're also sensitive during the changes of the temperature. For example, first day of heat wave, also they are very sensitive maybe in the last day of heat wave. They are very sensitive if the weather is changing because of the changing of the temperature, maybe changing of the relative humidity and other parameters. Next slide. Of course, why is this happening? This correlation between climate change or these thermal conditions and these public health elements like hospital admission or maybe mortality. We saw during our fieldwork measurements that there are inside the urban area, there are very huge differences according to the thermal conditions. Not only the air temperature, we have some changes in the air temperature, some differences, but much more higher differences are in these thermal comfort indices, thermal comfort parameters like temperature globe. And for example, next slide. In this very short distance, it's about 100 meters. For example, we can find the differences that are 12 degrees Celsius or more. Of course, it's very depends on the surroundings of this measurement spot, that some buildings, concrete, green areas also have effects on these thermal conditions. But in very short distance, less than 100 meters, you can find at the same time, same day, you can find very huge differences how our body feel this heat. And of course, that this kind of thermal influence have huge impact on our health. Next slide. What are the opportunities or barriers if we talk about the Serbia and West Balkans region or Southeast Europe region? Of course, most of the people are living in urban areas. More than 60 or 70% of the people are living in urban areas, and obviously that we also have to focus on the urban area. For us, the most problematic is the urbanization, the strategy and tendency of urbanization, particularly in the last 30 years. Most of the cities has very intensive urbanization, and this urbanization was that we don't go with new areas, but we are building higher and higher buildings inside the urban area already. And of course, this kind of urbanization has some consequences, and obviously that is not climate cautious urban design. Obviously that in region we have to work on this climate cautious urban design. This means, I will not go in details, but it means that some combination of buildings and green areas, blue areas, and try to find some optimal combination for the optimal thermal comfort. Next slide. Also, near these climate cautious urban designs, also very important, the green infrastructure. We have this nature-based solution already, those strategies from the European Union. We also have the one very recently published, the Bauhaus concept. All those concepts are based on the green infrastructure and mostly to bring the nature in the cities. And also we have to think about how to implement those infrastructures in our city, particularly in our public buildings, because it is not only the related with the efficiency of energy efficiency, but also it is related with microclimate, with air quality, and also with aesthetic, because it is also important. Next slide. Yeah, with this slide, I will finish my presentation, and yeah, for later question, I'm here.
Thanks so much, Stefan. Really appreciate that. And I really appreciate you talking about urbanization, because that is, you know, the planet is urbanizing, and when we get people moving, we're going to get people moving to urban areas. So I think it's really important that you highlighted urbanization like that. The urban heat island is a well-known phenomena, and I like how you displayed that in Novi Sad and the public health risks that come with that. It's very important to realize that and to talk about that, because there are solutions that we have there, and we have a well-known interplay between heat, air pollution, urbanization, and green space. So I really thank you for going through all of that and for giving us that overview of urban heat islands, specifically in the Western Balkans context. So thank you. Our next speaker, we're going to head a little further east now. We've got Anna Bedajenishvili. She is a sustainability and environmental policy expert at REC Caucasus, based in Tbilisi in Georgia. Some of her projects include Georgia's National Action Plan, the Civil Space for Participation in Climate Policies in Georgia 2023, and she's working on the Gender Action Plan for the UNEP, Sustainable Management of Agriculture, Biodiversity and Vulnerability in Ecosystems in Rural Communities in Georgia. So Anna is going to talk to us about the Caucasus region. So Gamajoba Anna, and over to you in Tbilisi.
Hello, everyone. Thank you for the wonderful introduction. I'm honored to be part of such a great speaker panel. And firstly, I would like to discuss broadly about what the Caucasus region is mostly. Next slide, please. So briefly, the Caucasus region is a land between the Black and the Caspian Sea. It's also dominated by the Caucasus Mountains, hence the name. And it's linguistically, culturally, and geographically a very diverse region with over 50 ethnic groups. And when it comes to talking about climate change, Caucasus region is already displaying signs of adverse effects from it, which includes rising temperatures and sea levels, also diminishing glaciers, changes in river flows, a shift in the snow and timberlines to higher elevations. More specifically, in the past 2 decades, extreme weather events such as flooding, landslides, forest fires, coastal erosions have become more frequent, which has led to, sadly, significant human casualties as well as economic losses. More so when we talk about what is expected to be seen in the Caucasus, we could talk about the increased acidity of water in the Black Sea is expected, which will lead to damage of marine ecosystems as well as plankton depletion. As previously mentioned, there are going to be rising temperature patterns, and especially in Georgia and Azerbaijan, there's going to be changing temperature patterns in the lowlands, which will result in migration of agricultural areas towards higher zones. And this transition will inevitably lead to loss of forest cover. Next slide, please. So when we talk about major issues in the Caucasus region, we must mention water scarcity. With increased variability and unpredictability in rainfall in the Caucasus, this change affects the availability of water resources, causing water scarcity in some areas, such as Azerbaijan experience major drought, and as well as issues with finding proper drinking water. Additionally, there's climate change poses risks to agricultural productivity in the Caucasus. Again, the changes in temperature and precipitation patterns already impact crop yields. They also increase incidence of pests and diseases and have been affecting livestock production. It is important to mention that the Caucasus is known for its rich biodiversity, but due to climate change, many species are put at risk. Thus, rising temperature and habitat degradation can lead to loss of plant and animal species. It can also disrupt ecosystems and impact the region's unique heritage and loss of its rich biodiversity. Finally, also one of the major pressing issues in the Caucasus is natural disasters. Due to climate change, it contributes to an increased frequency of extreme weather events such as floods, droughts, wildfires, and these events have already caused major damage to infrastructure as well as livelihoods and human lives. And the Caucasus region is having a hard time mitigating these issues. Next slide, please. When you talk about specific issues in the Caucasus, we must talk about transboundary water management, because the Caucasus region consists of several countries that are both downstream and upstream, and many rivers and water bodies are shared across borders. Sadly, due to climate change, the impacts on water resources require transboundary management and cooperation. There are already existing disputes over water allocation between certain countries, such as border tension between Azerbaijan and Armenia puts issues towards having proper management. Thus, there's an increase in competition for getting certain resources, which later on affects human health, of course. Additionally, the Caucasus region is experiencing decreased snow and glacier cover. As already mentioned, the Caucasus is home to many glaciers and snow-capped peaks, but climate change is causing a decrease in snowfall and glacier cover, which can impact water availability. Also, again, bringing the issue back of water scarcity and affecting ecosystems, agriculture, as well as hydropower generation, which is something the Caucasus is working on. Additionally, the Caucasus region is prone to earthquakes. Thus, melting of glaciers can further indirectly affect the intensity and quantity of earthquakes experienced in the countries. When talking about changing temperatures, the Caucasus region is experiencing increase in frequency, duration, and intensity of heat waves. These heat waves have had severe impacts on human health already, as well as agriculture, ecosystems, and it has led to heat-related illnesses which hadn't existed before, as well as crop failures and stress on natural resources. Next slide, please. As mentioned before in my introduction, I work with the Regional Environmental Center for the Caucasus, and I would like to briefly mention what we do. We are an independent nonprofit organization, and we're established to assist solving environmental problems as well as the development of civic society, specifically in the countries of the South Caucasus, which include Georgia, Azerbaijan, and Armenia. And one of our main tasks is to serve as a bridge between public and the government. And it's important to note that REC Caucasus functions as the only intermediary in climate-related cases between Azerbaijan and Armenia because of their border issues. Additionally, since the establishment of our organization, we have implemented over 60 medium to large scale projects related to different environmental fields. And we have contributed to policy development, capacity building, facilitation of dialogue and networking, also information exchange on environmental issues. And we have directly worked with governments to change policies as well as advise them on different things. There are certain work and research I would like to include. We have done multiple drafting of strategies and action plans for transboundary waters between Georgia and Azerbaijan, as well as Georgia and Armenia. We have also many projects for land degradation, such as land restoration and sustainable management. We have also aided in the establishment of biosphere reserves for climate mitigation in all three countries. We have contributed to drafting actions for various climate change-related conventions that the Caucasus regions are signatory of. And this is just to name a few of the projects and research we do. Next slide, please. When we talk about climate change, there are obviously opportunities and barriers for the Caucasus regions. Some of the barriers include, as mentioned previously, border tension. This is a very big one for the Caucasus. As Steven mentioned, we also experience high levels of urbanization, which functions as a barrier overall because most populations leave agriculture aside and move to major cities. More importantly, there's also lack of awareness between citizens, what it means, what the effects of climate change means, and what their each action affects overall climate and our Earth. Additionally, working closely with governments and ministries and also international organizations in the Caucasus region, there's a very strong need for a stronger legal framework, which is more climate friendly and green. And finally, I would like to mention the opportunities. Opportunities include climate adaptation and disaster risk reduction. As mentioned before, natural disasters have become a large issue in the Caucasus region. Thus, there's an opportunity for the region to deal with extreme weather events through investing in climate adaptation measures such as early warning systems, infrastructure resilience, and more importantly, community-based preparedness. This can reduce the impacts of climate change and enhance the region's ability to respond and to recover from disasters, which we have had to struggle with dealing with before. Additionally, promoting climate change education and raising public awareness about the importance of sustainable practices can foster a culture for environmental stewardship in Caucasus region and also put pressure on governmental agencies to foster more sustainable practices, including in legal framework. Additionally, educational programs, public campaigns, and capacity building initiatives can empower individuals and communities to take action against climate change overall. Next slide, please. This was my brief presentation about the Caucasus region and its effects and reality with climate change. If you have any questions, I'll be happy to answer later on.
Thank you so much, Anna. That was really interesting to hear more about the Caucasus and the importance of cooperation across the region, such as you mentioned the transboundary water management. You really also laid out so well the chain of effects that can be experienced with the ocean acidity and flooding, resulting in the farmers having to move to higher lands, affecting biodiversity there. So thank you again, and really great to hear about your breadth of work. I would like now to introduce Khurshid Alimov. Khurshid is the project manager at the Youth Group Protection of an Environment in Khurshid, Tajikistan, and their aim is to promote awareness on environmental issues by engaging youth in civic education and various other activities. And Khurshid has also worked on establishing cooperation between countries of Central Asia to really strengthen peace on various environmental challenges. So hello to you, Khurshid in Khujand.
Hello, thank you, Louise. Thank you for this very interesting webinar, and thank you for the chance to participation on this. And thank you for the speakers who talked before me, because they have given already a lot of information, which is true also for Central Asia, for our region. Specifically, what was described by Anna about Caucasus is very, very similar to what we have in Central Asia. Well, still with our own peculiarities and our own specifics. Could you next slide, please? So basically, Central Asian region has already is already feeling this pressure of climate change, and according to researchers, different researchers, this region has the least capacity for adaptation because we are landlocked, we don't have exit to the sea, and we have very vulnerable ecosystems. And the effects that we already observe in our countries, in Central Asian countries, is the rise of average temperatures, degradation of ecosystems, and loss of biodiversity, which is interconnected with all other issues like deforestation and desertification, which brings to more increased dust storms, which brings to melting of glaciers because of air pollution, because of this ice being covered by dust, and which accelerating the melting of glaciers. And also we have the changes in precipitation patterns, which brings to water scarcity and consequently to loss of crops, which is connected to well-being of the population. So it is a big challenge, which is interconnected in different spheres. For example, only in Tajikistan, for the last 30 years, we have lost 1,000 small glaciers. We have 14,000 generally we had, and we have lost 1,000 of them. And according to the volume, we have lost about 30% of glaciers just in Tajikistan only. And Tajikistan is 60% the source of all water resources in Central Asia. So this is the scale of the problems that we have now. Next slide, please. And as we know, these climate issues directly impact the public health, the well-being of the people. So, and it is represented in different ways. For example, first, it is extreme weather conditions like heat waves and like floods, like increase the emergencies because of extreme weather events. For example, as Kale was reposting recently, there was a research saying that just in Europe, because of this heat wave, about 61,000 people have died. We do believe that in these our regions, with people who have less capacity, less infrastructure developed, this number should be much more. But we don't have these numbers just because we don't have statistics and we don't have researchers. And also, this climate change issues impact the water resources, the agriculture, and as well. Because of that, it comes to malnutrition in low-income families because they do not have capacity to have a healthy food, which also brings to reduction in public health. Also, with air pollution, specifically with PM 2.5 levels, according to WHO, the average annual is 11 times higher than what guidelines should be. And also all of this pressure together, it brings to unstable socioeconomic conditions, especially in transboundary areas where there are some conflicts because of water resources, because of land resources. And yes, as we say, there is a lot of impact of climate change to public health, but this level should yet to be analyzed because we don't have enough statistics, we don't have enough data, and the medical institutions probably don't have enough capacity to do these researches. Next slide, please. Well, going to the measures that are taken, of course, the Central Asian governments, they do their best at a certain level to tackle these issues. They try to do something to tackle the climate change and integrate adaptation measures, but still, there are not enough resources, probably not enough knowledge, researchers, and capacity to do that. Still, there are some examples of, for example, Central Asian countries have put together the joint effort on saving Aral Sea, and we see now that there is a positive dynamics. Also, we can bring example of Tajikistan, which initiated International Year of Glaciers to be celebrated in 2025, and Tajikistan also initiated Water Action Decade 2018-2028 in United Nations. So these are some activities that the governments are doing. Also, there are a lot of international organizations supporting climate change adaptation issues through governments and through NGOs like our NGO and others. Next slide, please. And as we are an NGO and we are mostly work with people, so here we focus on challenges mostly in social aspect of the issues. What are the challenges we are facing in order to be effective in climate issues? And what we see in our work of our organization, which is working more than for 20 years in Tajikistan, we know that there is a limited access and limited availability of environmental information. Firstly, it's not because it's restricted, it's just because there is no enough information, because there is lack of experts who are doing researches. Therefore, there are very few researches being done, and probably the scientists who would be willing to do these researches, they don't have enough funding to do that. And also there is, and it all is interconnected because of this, we have a low level of awareness of climate-related issues among the population. And according to different sources, which have been doing some surveys from 2005, 2010, 15, and 2020, there is an average of from 15 to 45% of respondents who know something about climate change issues, and there are people who don't even know about what's happening. And because of that, these governments are also made of these people and from local population, so there is very limited knowledge of mechanism of climate change tackling between the decision makers also. For example, last year, our organization had conducted a survey in between of 100 people who are working for municipalities and for government in local state agencies. And this research shows that 80% of them do not have enough information about local, national, and international documents which are related to climate change. Therefore, even though we have strategies, even though we have some action plans for climate change mitigation, in the local level, in the lowest level of decision making, people just do not know the mechanism, how to do that. So most of the decisions just remain on paper. Next slide, please. So what opportunities we see to tackle this climate change and to get out of this climate change pressure for now? Of course, we have seen a lot of negative. We have said a lot of negative things about this. That probably we don't have enough capacity. We don't have enough knowledge. We don't have enough funding. There are a lot of reasons that we are behind, but still there are a lot of opportunities. The first thing that gives us hope that in future everything will change is that now we understand, and the global community understands that it's not separate problem of each country, and we can work together. For example, as now we are sitting in different countries and we are discussing it together. So this is an opportunity to tackle the climate change and with joint efforts. And also another opportunity, as we see that because of this cooperation, we can learn from experience of other countries, regions, especially from Europe, from Eastern Europe, where the climate is more similar to us, from United States probably. And another opportunity is that by learning of these mistakes that have been committed in European Union or other countries, we have a chance just to leapfrog, to learn from their lessons and just implement what is best and leave what was dubious or what didn't give a result. Next, please. And as an organization working on environmental issues and also with climate change as one of the main issues considering environment, we have been working for 20 years. What we have been doing for now and what results we have is, first, in 2021, we have installed the first air quality monitoring network in Tajikistan with low-cost sensors, but still it is the first independent real-time data which we have across the country in all the major cities. So we just can see the air quality situation there and compare to what official meteorological stations give, because we have these official meteor stations. We have good connections with them. We do work together with them, but we understand that they don't have enough capacity and the equipment is mostly outdated, so they don't have enough capacity to give real-time data. Next, please. Also, as we know that the lack of information and understanding is the main reason for being behind in climate change issues. We are working with different levels of society, starting from youth. For example, here in the pictures, you can see that we're working at schools, raising awareness and doing education and activities. Next, please. Also, we do stakeholder involvement. So we have this roundtable with stakeholders in different cities of our country, where we invite specialists from healthcare, specialists from government, specialists from environment agencies, from NGOs, local activists, and we discuss and try to find solutions for the for the problems that we have, and the solutions and all the suggestions are put together in one paper, and usually they are given to the government as a letter of recommendation to be included in the planning of the future activities. Next, please. We also do some restoration work or some biodiversity conservation work and some researches in the field, because we know that with the pressure of climate change, the ecosystem degradation is accelerating, and soon we can come to a time where the problem will be not able to be reversed. So we're trying to do our best, and we have a small success in this area, and we are still going on for that. Thank you. Next, please. Also, we do some adaptation measures in households, but these are very small integrations, but still we try to help people in rural areas to increase their crops, to increase their capacity, and implement water saving measures, because the main problem in rural areas now is the scarcity of water resources, and the thing that the old methods of agriculture are not working, because they used just to do flat irrigation and just put the seeds and collect the crops. Now it's not working because the volume of the outcome of crops is very low, and so that it affects the stability of the households. So this is what we're doing at a small level now, but still to do for fighting climate change issues. Next, please. And what we are focused now on, and what we think that should be done in our region, is first is to develop monitoring systems, for example, for air quality and for ecosystems, because there is very limited available data. And also we need to involve young researchers or universities, because there are no researches being done, and we need to involve and coordinate all the stakeholders. So we have to come all together to solve this problem. We cannot just sit and wait for the government to do that. It's not possible. And because of that, we need to integrate this environmental subject to school and university programs, which are lacking it now. And after it, we need to build platforms for information exchange and awareness raising campaigns. And we believe that putting together all of these efforts together with the society and together with other countries and with organizations from other countries together, we probably have still time to mitigate the negative impacts of climate change, and still emerge as a winner from this fight with climate change and the loss of ecosystems. Next slide, please. So this was generally and shortly about Central Asia context, what we are doing now, and what we think is necessary to do next. Thank you very much. And if there are any questions, we'll be available. Thank you so much.
Thanks so much, Khurshid. I really, really appreciate that, the perspective you laid out there. And yeah, some of those figures you quoted are really quite striking. You know, when you talk about the disappearing of glaciers, and the survey looking at 80% of civil servants not knowing about the documents available, and the lack of data that you were talking about. So lots of reasons for action there, and I appreciate you highlighting all of those. But yeah, also, you know, you've laid out exactly how we can go and how we can be the winners, as you've said, which is, I think, a really good way of phrasing it. You spoke about the youth, which perfectly leads into our final speaker. So we're going to go just over the border and leave the health bubble. We're going to go to Farrukh Abdurabayev. So Farrukh is in Fergana in Uzbekistan. He's an English teacher where he runs an English language school with about 1,000 students. So Farrukh is going to be joining us and some of his students to talk a bit about climate change, their aspirations and barriers they face. So I can get Farrukh to come online. We're in Uzbekistan, it's currently about 40 degrees, I've heard. So, Farrukh, are you there? Okay, while Farouk is coming online, I just wanted to run to a question from the chat that I think is very relevant. Oh, we've got Farouk. Hi.
Hello.
Hello.
Okay, so I'm sorry for all the interruption. So, okay, so
Go Farouk, it's all yours.
kind of, hello, my name is Farouk and I am from Uzbekistan. Can you guys see me? Or
Yep, you can see and hear. Yep.
Yeah. So my name is Farouk Jan and I'm from Uzbekistan, and we are representing an education center. We mainly teach, we mainly prepare students for the IELTS test, International Language Testing System. And in our courses, we have like questions like what kind of global problems and in terms of ecology is affecting the world. So what kind of solutions can you give? So we mainly talk with our students about this. And we have a lot of students in our education center, like around 1,000. So, and Kale is an old friend of mine. So he asked if you can give us like insights of your region, how this global warming is affecting we are going to cover. So basically, the main problem in our region, in my opinion, is going to be the poor like drainage system, and we have canals filled with a lot of dirt. That's why when it rains, all the houses are really flooded, and during the hot summer days, we have really hot streets. For this reason, a lot of people like quickly turn to air conditioning, and they put them into the maximum level. So I guess the way forward, like solving this problem, involves like improving the canals and ditches in the city. And I believe in all streets there should be running water. Like there should be water with a flow, which would like lower the temperature of the street. In this, it can also like water the plants. It can water also the trees in the area and make the area greener. And that's basically it. And we also have some kind of border issues with electric cars. Like they have 5% of kind of tax or something. And reducing all of this would be a nice thing to see in our country. And we also have some students who are participating. And Kale, can you hear me? I can't see you.
I can hear you. We can all hear you, Farouk.
Yeah, thank you. Can we see you as well? Because we are just looking at the yellow dot, and it's somehow difficult to speak. So yeah, I'm giving the seat to the young gentleman from Uzbekistan. His name is Shavkat John Hojanberdiyev. He's maybe you have heard this name. Shavkat is the name of our president. So yeah, he is a namesake, and he's going to represent youth in this session from.
Hello, I'm Shavkat John, and I live in Fergana region in Uzbekistan, and in my country there are several environmental problems, and the most visible environmental problem is land use in our country, because when you visit our country you can see lots of areas that are not in use, and they belong to the government, and the government didn't sell those areas to the entrepreneurs or citizens of Uzbekistan, and now some people threw their trash, and they are contributing to some problems such as climate change and other problems. And to tackle these problems, the government should sell those areas for low prices to the entrepreneurs or citizens, and they should build some theme parks or houses. And when they are building park, they should plant trees, and climate change will decrease. And if they building houses, they should there's a unique material, and I don't know the name, and if they use this material, it in the hot summer days, it keeps the cold, and in the winter it keeps hot. And that's all.
So he was talking about the places that belongs to the government, and its regulation is really difficult. So giving out to those people who can take care of these lands would be a proper action. So his idea was that. Okay, we have another student. Her name is Mahchehra, and she's also going to tell her ideas. Shaukat was 8th grade student. Mahchehra is 11th grade student. Okay.
Hi everyone. My name is Mahchehra, and I'm from Fergana in Uzbekistan. We all know global heating has been considered one of the most global serious issues needed to be addressed as quickly as possible. It is also occurring in our local area, and I think it is a problem caused by human activities and personal consumption. Well, here I'd like to share one of the causes and one of the solutions for this problem. Well, fossil fuels, coal, oil, and gas are by far the largest contributors to the climate change, while they are widely used to produce electricity. The more they are burned and extracted, the worse climate change will get. In order to reduce the use of fossil fuels, we should change our main energy resources to clean and renewable energy. One solution that I can offer is installing hydropower systems in local areas where there are ditches. It is a renewable source of energy that generates power by using a dam or a diversion structure to alter the natural flow of a river or other body of water. It relies on endless, constantly recharging system of water cycle to produce electricity using fuel, water that is not reduced or eliminated in the process. It relies, and by reducing our reliance on fossil fuels, hydropower also avoids a large tons of greenhouse gas emissions being emitted annually. Beyond its power benefits, it also provides water services. Reservoir water storage capacity can be used for drinking water supply and irrigation. As an important renewable energy resource, hydropower can significantly contribute to the avoidance of greenhouse gas emissions and to the mitigation of climate change. So I can say that it is much safer and better for the environment than using any other sources of electric power using fossil fuels. Thank you. That's all. Bye.
Okay. So these were the students, and thank you for the opportunity of giving all these students being a part of something bigger than themselves, something important. If you have heard, I wanted to end my speech with the saying that, like, I'm really interested in Elon Musk. You know, everybody says he's a billionaire, but by making, running a Tesla company, he's also contributing to the saving our planet, as well as he's planning to go to Mars. When he was a child, like when he was only 10 or 12 years old, he made a game called Starlink, and it was about making rockets and sending them to the space. It was a small computer game, but when he grew up, he's now actually making real rockets. Like all these young people that you have listened to today, maybe their ideas are really simple. Maybe they have, maybe their ideas are really difficult to implement, and they are just ideas appropriate to their own age. But I hope when you foster these kind of children and you tell them that they can change the world, when they grow up, I believe they also going to have really, outstanding ideas, because one small step forward is the thing that needs to be snowballed, snowball effect. When they just participate this event, now they are more environmentally conscious. They're going to sit these ideas and they will start to think about that. Maybe in the future, I hope these young people will change the world to the better. Okay, thank you.
Thank you so much, Farouk. I couldn't have said that better myself. So very well summarized, and I think that's a good call to action for everyone. So thank you, Nakshara. Thank you, Farouk. Thank you, Shaka.
Yeah. Just
really appreciate that.
Yeah, thank you. Just tell young people to be responsible, because they are the future.
Definitely,
you can
couldn't agree more.
Change the future by changing the ideas of young people. Okay, thank you.
Yes,
thank you for inviting us to the event.
Quite all right. Thank you for speaking. Really appreciate it.
Kale.
Thank you. Great, thank you. So everyone, we are running a little over time, but we do have a few questions that I just wanted to get to quickly for people who can stay. I'm quite happy we've already had some speakers have to leave, so I will redirect the questions a little bit. But the first question we had in the chat that I thought was quite interesting and a good topic for discussion, I might address at Laurent. So I know it's not exactly your field, Laurent, but I would like your opinion on it. What do you think, how do you see the collaboration internationally between governments? How do you think kind of collaboration between nation states is working, and compared to collaboration between regions and regional bodies? Is there a role for a kind of pan world government or something to face these changes? How do you see those sorts of interplays?
It's quite difficult to answer such a question. What I could say is, first, I think that we have to develop a coalition at the European level, because it's something that we can do, I think, and it's ongoing anyway. And after that, I think that also if we want the different governments to move, they have to be pressed. So I think that the coalition of NGOs all over the world, the way that we could design such alliances, and the alliances between the people in public health, between the people who are in the healthcare sector, and people who are in the global sector, environment, ecosystem, NGOs, and so on. If we are able to have such an alliance, I think that it's a way to be able to change the government's position. And one other thing, very, very quickly, we have also to demonstrate, and it's what has been done all this morning, to demonstrate how urgent it is, and that we have data, but these data have to be shared. And it's perhaps one of the best thing that we can do is to share the data, just to raise the awarenesses of the government.
Yes, absolutely. Thank you for that. So collaboration and sharing. Great. I appreciate your answer there, Laurent. Really. Thank you.
Thank you.
We had another question, and it relates to Ina's speech earlier. And Ina and I and Louise have talked previously kind of about the justice angles around changing climate. We just had a few questions, Ina, that related to homelessness and to young child feeding. So, how can we apply these kind of international justice, ethical concerns that you've talked about, in particular to migration? How do we see that affecting homelessness? How do we see that affecting youth and I guess youth raising, youth nutrition, that sort of thing? What is your opinion on that sort of thing?
Thanks, Cale. Oh, a nice combination of questions there. I think really, I suppose I don't have a very finessed answer on it, but I'd say in relation to migration and so on, I mean, I think we in Europe are big users of fossil fuels. We have created part of a big proportion of the world's climate change problem. I think we have a duty to reverse as much as we can. We are very slow to do it. I think we have been bought over by industry to a certain extent. And I think that's one of the things we've got to start calling out, the big interests that that influence our policy. I do think we need to be talking about our duties to people in countries that are struggling and suffering much more than Europe. I think that, I personally think something like, I should pay when I'm using 4 times the number of the amount of the ration, whatever a human ration should be to keep of emissions. If I'm using 4 times that amount or 10 times that amount, I should be paying for it. It should be going to people who aren't using that. How to do that? It requires an awful lot of fair financial transfer, and you need to have very good strong civil societies in countries that can make sure that there isn't the siphoning off resources, that type of thing. So I think it's building the NGOs, partly the advocacy was just being talked about there by Laurent, but maybe also those NGO sort of governance as well around how we divest in resources. That's one element of it. I think another is we have to recognize the fact that we are going to be recipients of, people are going to come to our countries. The countries that are safest are going to receive an awful lot of people who want to live there because it's safer than where they came from. Ireland, for instance, we used to go to America and Canada and Australia and New Zealand because we had a famine in Ireland. We were transported because we were part of we were colonized as well, and so on. So Ireland knows a lot about this, but we are now going to be recipients, I think, and we need to give back some of and I think a lot of countries, we need to start being generous and sharing our resources with others, the resources we do have, but we need to get our act together in relation to policies to prevent homelessness and to reduce it and so on. And it's interesting, it's lovely to listen to all the different types of talk to people that have here to learn from each other, because I know in Ireland we live, we're sort of cut off as an island, and I don't necessarily engage enough learning good ideas from other countries. So I think these, again, alliances are terribly important to learn from. And talking about infant feeding, we recently, I'm part of the Climate and Health Alliance within Ireland, in which we did an analysis of the food system in Ireland, and I'll just pull it up in front of my eyes here to remind myself. But there are 6 big areas that we found, and one of them would be infant feeding being, number one, recognizing breast milk is the number one infant feed, and yet in Ireland we have huge dairy industry that's pushing dairy feeding. So we've got to start challenging the big industry that goes against supporting women to breastfeed, because in our policies, it's say in this country here, for maternity leave, it's women are punished really for having kids. That might be the same in many countries. Really, they're damaged. They're not encouraged to really nurture children. They're encouraged really to try to get back to work as soon as possible at the expense of really the development of the next generation. So there's a lot of coordination of all our policies to get them right. And I think even just that food document, I think they really pulled that food analysis really looked at influence of, we're weak in comparison to some of the big voices that are influencing governments. It's government to solve this really with the public doing it, but you can't do it without government support. And I think that we're all victims of the junk food cycle, really, and so on. So we're putting all our energies into the wrong things, and we're not putting them into the right things. So it's redirection, real strong transformation and redirection from the policies that suck up all our energy to trying to do the right things. And I think, it's a hard job, but actually it's a good question, Cale, because they're all interlinked with each other. Yeah. Okay. I'm sorry I don't have a succinct answer.
No, that was great. You covered quite a lot of things there. I don't know quite where to start, but yeah, that was excellent. Thank you. Yeah, I completely agree with everything you said, and I really appreciate you touching on the gender angle there. I'm sure we could have a whole week-long workshop on gender and climate change. So I appreciate you bringing so many threads in there. I think it speaks to a lot of the complexity, a lot of the challenges, a lot of the things we need to challenge in general. Thank you. I really appreciate that. We do have just kind of one final question. As said, we've had to have a few speakers leave, but we've got Stevan from Serbia still here and Khurshid from Tajikistan still here. So I'll direct the question towards them. The question was, when we talk about climate change and public health risks, when we communicate this, what's your opinion? How should we communicate? Should we focus more on the positives of green spaces, for example, the positives of nature restoration? Because, we've talked a lot about the public health risks in this meeting, and these things are scary, and these things cause things like eco-anxiety. So to combat that, when we communicate, what's your opinion on how we should do that, how we should motivate, and should we focus on positivity maybe over despair? Stevan?
Yeah, we talk about the city and the population in urban areas. Maybe we can try to make some efforts in two ways. Obviously, we have to bring the nature in the cities, that people feel much more relaxed and to have the quality of life, because quality of life is related with public health. Maybe not for us as a climatologists, we are maybe not so good experts in that, but maybe people from medicine, people from psychology or some similar focus also can advise us how to motivate people to use the nature. Because also what is problem with the public health in the cities, what we saw. Okay, we have the higher temperature, we have the relatively low air quality, but also lifestyle of the people is also problematic because of the work, a lot of hours in work or traffics and others. And also this effect, it's additional that affects on population. This is the combination of elements, and maybe for our regions, for the countries who are in developing processes, maybe needs more information and more actions.
Perfect. Thank you, Stefan. And Khurshid, same question to you. How do you think, when we communicate going forward, what are the messages? What is the tone we should strike? How do we balance risk versus opportunity and hope and positivity?
Well, I can answer in context of our region, the people with whom we are working. And it is a bit different regarding with what is there in Europe, because here, before you are speaking about what is optimistic or what is pessimistic, you first have to deliver the message itself that these changes that you are seeing have this course. And in order to tackle this cause, you need to you have to do some behavioral changes, not just in yourself, but starting from your family, starting from your children, or starting from your friends, and on and on and on. But to avoid the negativity, and this must do, you can involve them like in activities like we are doing now with school children. So you make it an event which is very joyful, was playful, but still there is a lot of integrated educational and advices inside that. So probably this is a way that you motivate them, that they just learn that this is good, and this is how you need to live in order to be good for yourself, for your family, for the world. Probably this is one of the ways with children, and with adults. Well, sometimes in this case you have to do you have to tell the truth that these are the problems and you have to solve. probably like that.
Absolutely. Great. Thank you, Khorshid. And I think, yeah, when we heard our students speak before, I think, that links into what you're saying there, in that, as Farouk was saying, to have people involved in that, to have people involved in the conversation does create momentum. Great. So I'm gonna finish up the webinar now. Thank you for everyone who joined, and thank you so much to all of our speakers. I really think that we covered a lot of ground there, in that we could look at multiple different levels, multiple different regions, and kind of get a bit of a summary of where we are and how we go forward. And we to focus on justice, we need to challenge the current narratives, and we need to communicate, and we need all these things, research, everything. And youth voices, I think that's super important as well. So I really do want to thank all of our speakers, and hopefully you're all behind your cameras giving a clap to each other. And I really thank you to all of our participants today. This is part of the start of EPHA's work on climate change, so we're going to continue the work, and we're going to be looking at health equity, about justice, about communication. So yeah, we look forward to a useful dialogue, and really appreciate everyone coming today. And thank you very much for your attendance.